Are you thinking about buying a horse but aren't sure about the pre-purchase exam? This video walks you through the 8-step process, offers some tips on how to have a good experience, and what to do with the results. Make sure to check out the link below for more on this, and go to bitsandspurs.org for country western news, keeping pace with today's rodeo. A PPE is a thorough assessment conducted by an equine vet. It's a snapshot of the horse's current health and soundness, but it has its limitations. Before you request a pre-purchase exam, go and meet and ride the horse. Think about how its temperament, training, and riding suitability falls in line with your expectations. Once you're convinced you're interested, then the next step can be to get a PPE. But not every horse sale needs a PPE. Many riders believe that there's no sense in spending more on the PPE than the cost of the horse. And a PPE can't predict future problems with certainty, it can only give you a picture of health today. The seller should disclose any known health issues to you, including past or present health issues or trips to the vet. If you're an inexperienced buyer, find someone who knows more about horses to help. Remember, there is no perfect horse, but there probably is a good match for every person trying to buy a horse. Make sure you know and trust your vet and that you are comfortable interpreting the PPE results and how they apply to your discipline. A standard PPE typically includes a thorough review of the horse's medical and performance history, a comprehensive physical exam, movement evaluation, flexion tests, and sometimes diagnostic imaging and blood testing. There is a fee for the exam and a fee for additional add-ons. There are roughly 8 steps in a PPE. Number 1, find a trusted vet. Either have your own vet perform the PPE or find a vet that is not associated with the seller at all. And make sure the results go directly to you. Number 2, eye exam. An eye exam is part of the physical exam in a standard PPE. It can detect somewhat common conditions like equine recurrent uveitis, ERU, or moon blindness. Notice any signs of blindness or visual impairment, such as unusual clumsiness, hesitation, or skittish behavior. Number 3, respiratory check. Your vet should perform a respiratory check, which includes listening to the horse's lungs and trachea with a stethoscope, both while at rest and ideally during activity too. Hearing any unusual respiratory sounds, such as wheezing or crackles, can be an indication of a respiratory illness or infection. Number 4, lameness exam. A lameness exam finds issues related to movement and gait. Your vet should assess the horse's movements on a hard surface, both static and dynamic. This involves watching the horse walk and trot, both in a straight line and in a circle. The focus is on identifying any unevenness, stiffness, or signs of discomfort in the horse's gait, which can indicate underlying lameness. Number 5, flexion test. Flexion tests are a little controversial. They can provide valuable information about the animal's joint health and potential issues, but the results can be affected by the horse's age and how much pressure the vet uses during the exam. A horse showing discomfort during a flexion test doesn't necessarily indicate a serious problem, but signals the need for further investigation in that area. Always consider it as part of the bigger picture. Number 6, hoof test. Your vet should perform a hoof test to rule out disease, injury, or sensitivity using a specialized tool. She will apply pressure to different areas of the hoof, looking signs of discomfort, which can indicate bruising or heel pain. Number 7, radiographs or X-rays. These are add-on tests that often come with an added expense. They offer a comprehensive view of the horse's skeletal structure and almost always show something in the bones or joints, like arthritis or old fractures. The vet may also recommend ultrasound or endoscopy, which can further assess bigger issues. Number 8, blood work. This is usually an add-on, but is sometimes needed. But it can be useful to detect equine infectious anemia, EIA, a serious viral disease and issues with the horse's organs. You may also want to get a drug test to check for medications like painkillers or sedatives, which could be used to mask pain or behavioral issues during the exam. When it's done, your vet will reach a conclusions based on their own knowledge, evidence-based medicine, and experience. She should be very clear with you about which of those they're relying on for which part of the exam. Your vet might want a second opinion for something outside of their expertise. Be patient because a thorough conclusion is really what you're interested in. And once you have it, it's time to decide what the results mean for you and your situation. Ask yourself if any of the findings prevent the horse from performing the work you need him for, and if there were any expensive illnesses that will need to be managed and might exceed your budget. Remember that most horses do change regardless of what's going on at the PPE, when they get to a new environment and are managed, trained, and ridden differently. Even if a horse passes or fails the PPE, always trust your instincts, find a trusted vet, and consider the long-term implications of the purchase. Make sure to check out the link below for more on this, and go to bitsandspurs.org for country western news, keeping pace with today's rodeo.